Hi everyone, it's Dr. Iggy DeLeon here with my first video. If you're new to my channel, I'm a general dentist sharing about my practice ownership journey and some dental tips. This first video is going to go over the top 10 frequently asked dental questions according to ChatGPT, which is an AI program that I just asked this question. So let's see how this goes. Question number 1. What is the best way to take care of my teeth and my gums? Well, according to the American Dental Association, you should be brushing your teeth twice a day for 2 minutes. Don't forget to floss because that's just as important. Make sure you use a soft bristle toothbrush. That way you don't damage the outer layer of your teeth called the enamel. So the best routine I would say is to floss first, rinse out all the stuff that came out between your teeth, and then brush last with a fluoride toothpaste. Now, you may have heard, don't rinse with water after you brush. Well, it might sound weird, but that's actually true. You want that fluoride and the other nutrients of the toothpaste to stay on your teeth overnight to protect your teeth from cavities. So, although it might be weird to get used to, just make sure you spit out the excess and don't rinse. Question number 2. How often should I go visit the dentist for regular checkups and cleanings? Well, typically, you should be seeing a dentist about 2 times a year, which is every 6 months. That's to make sure that the dentist can catch cavities when they're small or any other problems before they get too big. Now, if you haven't been to the dentist in a while, it might take more than 2 visits a year to get you back in one piece. Question number 3. What are some common dental problems and how are they treated? Well, one common problem you've probably heard of is called gingivitis. Gingivitis is basically the inflammation of the gums due to bacteria in the plaque on your teeth. So plaque is a soft, sticky substance that forms in your teeth, and the bacteria there, they eat what you eat, and they basically poop out acid, and that acid irritates your gums. It causes your gums to look red, be puffy, and they hurt a lot when you're getting cleanings because they're so irritated. So that's why it's important to floss and brush. Another common problem you might have heard of is called a cavity. A cavity just means a hole. In this case, it's a hole in your tooth. This is formed when the bacteria, they break down the tooth through the acid byproduct, and they burrow through the outer layer first, called the enamel, which is a hard layer of minerals. Once they get through that into the dentin, the inner layer of the tooth, which is much softer, that's when the cavity gets much larger. So it's best to take care of them when they're small. Question number 4. What's the difference between a dental filling and a crown? Well, since we just talked about a cavity, what happens is after the dentist cleans out the decayed tooth, there's going to be a giant hole in the tooth that has to be filled or else bacteria will get back in there. So what we do is we put usually a tooth colored material and we bond it in and seal up that hole. If the cavity is too large or the tooth had to get a root canal done because the nerve is affected, then you would have to get a crown, otherwise known as a cap, placed on top of the tooth. This is when the dentist grinds down around the tooth to make a nub, like a miniature tooth, and then a crown, which is made of metal or porcelain, is bonded or cemented on top of that nub to protect it from further damage. Now these can still get cavities around where the crown meets the tooth, so you still have to protect it and make sure you clean it well. Question number 5, can you recommend any teeth whitening treatment? Well, the best course of action would be go to your dentist for professional whitening. This is to ensure your safety and also to get the best results. We use a material called hydrogen peroxide or carbamide peroxide, and we place it on your teeth. And this could be really dangerous to your gums, so we place a barrier in your gums to protect it from being burned. Now, this hydrogen peroxide will go through the outer layer of the tooth, the enamel, and basically oxidize the dark molecules that are within the tooth, so it'll make the outside much whiter. I would highly suggest against whitening toothpaste. They work in a different way. Basically, it's a more abrasive toothpaste that, yes, you'll get whiter teeth because they're gonna take out the extrinsic stains like from coffee or wine, but that abrasive toothpaste will also eventually wear out the enamel of the tooth, exposing the dentin, which is the softer inner and yellow surface of the tooth. So it'll look darker and you're gonna have some teeth sensitivity. Question number 6, how can I prevent cavities and tooth decay? Well, cavity and tooth decay is the same thing, first of all, but it's a whole process of how cavities are formed. Basically, it's an ongoing battle with the pH of your mouth. The bacteria love an acidic environment. So if you're eating a lot of carbohydrates, sugary food, they're gonna have a good time there. And the longer that your mouth stays in an acidic state, the longer or more time the bacteria have to penetrate through the tooth and cause a cavity. I love candy, I can't give it up. The best thing to do is to limit that snacking to just a short amount of time so your mouth is not acidic so long and it can go back to normal levels. If you're snacking throughout the whole day, then the bacteria gets in a party there all day and you're gonna get cavities much faster. So limit the snacking to a certain amount of time and then rinse out with water after. And also make sure you don't brush your teeth right after eating something acidic. Your teeth are softer during that time, so you could be doing more damage by brushing off the outer layer of your tooth. Question number 7. Is it normal to experience sensitivity and what can be done about it? I would say that occasional tooth sensitivity is okay, but it could be an early sign of a cavity or other problems like gum recession. Gum recession happens for a couple reasons. One reason is brushing too hard. You could be damaging the gums, irritating them, and they recede, showing and exposing a layer of the tooth that is more prone to sensitivity. Another way that could cause gum recession is from poor oral hygiene. Gingivitis, a bacteria that's going to wreck your gums and they're going to recede, causing the same sensitivity because the tooth is more exposed. One more way that gum recession occurs is from clenching or grinding your teeth. When you bite down, it's a lot of pressure, a lot of force, and that force has to go out somewhere. In this case, it goes out sideways, and the weakest part of your tooth is near the gums, and it starts getting these notches that get closer and closer to the middle of the tooth where the nerve is. So that's why you could be experiencing some sensitivity. So in that case, you might need a night guard. But one solution you can have for the sensitivity is using a toothpaste called Sensodyne. It's my personal favorite. I like this toothpaste because it's non-abrasive and the active ingredient in it is called potassium nitrate, and it plugs up the little holes that are leading to the nerve. So you use this every day, every night, and it'll put a protective layer. But if you stop using Sensodyne, those holes will open up again and you can experience the same sensitivity again. Question number 8. What are the types of braces that are available to align your teeth? Well, there's two main ones. First, we're all familiar with is the traditional metal brackets. I had those. Yeah, they weren't great, but I'm happy with my smile, so it was worth the pain. The other more recent type is called clear aligners. You might know these as Invisalign. That's the most popular brand. They're basically clear trays that you switch out every 1 to 2 weeks, and they gradually align your teeth. Now, even though the technology is getting better and better with these, there's still some limitations, and you might still need the metal brackets to get the appropriate movement. Even with the metal brackets, sometimes there's only so much you can do to tip the teeth without losing stability. So you might also need some jaw surgery to align your jaw and then your teeth. Question number 9. How does gum disease develop and what happens if it's left untreated? This is a really big topic. Basically, the umbrella term for gum disease is called periodontal disease. Now, the supporting structures of the tooth is called the periodontium, and this consists of the gums, the bones, and the fibers that allow the roots of the teeth to move a little bit. So under periodontal disease, there's two branches. One is gingivitis, which we talked about which is the inflammation of the gums caused by the bacteria. And the other part is called periodontitis, which is inflammation of the bone. So like I mentioned earlier, the plaque that was once soft and sticky turns into a hard substance called calculus, and that bacteria burrow down into the bone and they destroy the bone and destroy the stability of your teeth. A lot of people just think we lose our teeth because of cavities, but most people don't know that it's just as important to have good stability with the bone and the gum. You've probably heard about the treatment called deep cleaning. We call it scaling and root planing. What this is we get you numb and we clean way below the gums, get all that calculus out, all that bacteria out. That way your gums and bone can heal again, and we hope that it will bring back the stability of your teeth. Once you go through that, you usually have to come back for more maintenance. So you come back to get your teeth cleaned maybe 3 to 4 times a year instead of the usual twice a year. That way we don't have to go back to the deep cleaning as long as you maintain your hygiene. Question number 10, we're almost there. What should I do if I have a dental emergency, like if I broke my tooth or if there's severe toothache? First of all, you should contact your dentist. There's so many different variables. It could have been that the tooth came out, called an avulsed tooth. It could have been the cracked tooth or just a chip. So we have to evaluate and make sure that we give you a proper diagnosis. So yeah, those are the 10 frequently most asked questions according to ChatGPT. I hope you guys enjoyed this video and hope you guys learned at least one thing from this. If you have any dental related questions or anything about me, feel free to let me know in the comments and I would love to address that in a future video. If you haven't already, please subscribe if you want to follow along my journey as a private practice owner and also to get to know more dental tips. I'll see you guys in the next video. Bye.